Good afternoon, viewers. This is Mystery Professionals TV. I am your host, Eunice Abbey. You can call me Nkrumah. Today we are at the Ghana Psychic and Traditional Healers Association. We want to learn more about tradition and herbal healing. And so our guest here will introduce himself. Then he will throw more light on what this association is about. Sir, can you please introduce yourself?
I am Emmanuel Nunyaku Mensa. I'm a medical doctor by profession. I retired by now and have learned into our traditional medicine as an administrator and subsequently as a practitioner and keen follower of traditional medicine.
Thank you, Doctor. Can you please tell us about the association? We want to know more about the association, how it came into being, the role it has played to help our nation, Ghana. We want to know more about it.
It was during the time of President Kwame Nkrumah that he decided, because of certain experiences of some of his staff, to organize our traditional healers into an association so that they can have a common voice and also to organize themselves in such a way that their welfare will be taken care of. Now, before that, there were two associations of traditional healers, one based in Sekondi and one based in Accra. And Kwame Nkrumah united the two of them to form the Ghana Psychic Healers and Ghana Psychic and Traditional Healers Association. And membership from all the four corners of Ghana, north, south, east, and west. And the first president was Nana of Akonedi Shrine. Nana Paribia of Akonedi Shrine. And then subsequently there were other presidents. Now, traditional medicine has several components. You have the herbal aspect of it, you have the psychic aspect of it, and you have the diagnostic aspect of it, and the cultural aspect of it. And some of the practice include traditional circumcision, traditional midwives also are included, and there is a small group that do traditional surgery, like bone setting. So there are several types of traditional group within the traditional healing setup. The herbal component is what we in orthodox medicine understand, because it's comparable to pharmacy. Now, when somebody is not well, that is at the traditional level, he call in a healer, or he goes, may not ask questions at all. But you have to diagnose the disease. And the disease could be one's own body malfunction, natural. It could be spiritual attack. And it could be due to infraction of some cultural do's and don'ts. And it is based on that diagnosis that they will formulate what type of treatment is suitable for your illness. And you have some of them who are specialized. The divination aspect is the diagnostic aspect. And there are some of them who are specialized in divination. Again, there are several methods of divination. Some can see. Let's call it the third eye. Some will look into water in a calabash. Some may throw certain objects on the ground, items on the ground, special ones. Through that, they can diagnose your problem and then formulate treatment. So it varies. The herbal aspect is what we have all gotten to know now. But we shouldn't forget that the revelation of which type of herb is suitable for which type of disease comes through the divination. So the divination is a component part of the traditional healing. The healer himself that you've gone to may not be a divinator. Okay. So he will send you to somebody he knows who is a divinator. Depending on what the divinator says, then he will know how to formulate the treatment regime for you. In short, traditional medicine has got so many aspects to it and types. And various traditional areas, ethnic groups, have got slightly different or sometimes completely different ways of practicing it. It is not homogeneous. So what do they practice in Volta region, Ashanti region, Greater Accra, Northern region? Not exactly the same. They are different. But they all do the same thing, which is purely traditional way of healing. And that you cannot really say that one is superior to the other. You only want to make sure that your patient get well. That's all. It's the same thing. In orthodox medicine, there are several types of practices. You have the gynecologists, you have the pediatricians, you have the surgeons, you have the urologists and all that. You all do different things, all to help the people.
Thank you so much. So would you say that people have understood your style of healing and have patronized your area of healing and solutions to our problems? Do Ghanaians understand it that way, or they only understand the orthodox medicine side? How have you also made people to recognize or realize that this is also a very good channel of healing for the individual, to whoever needs healing?
Let me say it up front that I don't practice traditional healing per se, but I know enough to direct people what to do or where to go. But basically, I'm a medical doctor. Okay. That's the aspect I look at first and foremost. You can realize from a patient that this ailment of the patient is not for orthodox medicine. Okay. He must go to a healer for help because it may be a spiritual attack. And you got to know enough to be able to detect that what the patient is presenting is not for pure, orthodox medicine management. You have to seek traditional practice advice.
Thank you. So how has your group been able to come together to help the public in that line? Has the group been effective enough to give this help, the traditional help, the herbal medicine help to people, because it depends on the individual will say, this thing that is happening to me, let me see a herbalist. But because we have an association, I think there has to be enough advertisement for the association to make people aware of your presence, because there are so many people who are there, they don't even know what to do when it comes to that. Please, do you understand my question?
Well, let me guess. Now, the association is basically a welfare organization to protect the interests of the traditional healers. Because there are so many different types of healers within the association, traditional healers within the association. And each practices his or her own traditional area of traditional medicine. So the association does not advocate where to go and whom to go to. But we know, although people may not accept that, every Ghanaian, African knows about traditional healers. But some will make themselves available, some will not make themselves available. Religious beliefs. But they all know that traditional medicine exists.
Actually, what I'm trying to say is that there are now herbal hospitals doing so much adverts. Looking at this association, it is an advantage to people. So if it is not a hospital which you come and say, I am this and that herbal hospital, but you are a group of healers who can help people. You understand me? So because apart, if not for a friend who told me about this association, I have never heard about it. Okay. And listening to you now, it looks like you have so much help for the public, but we are not hearing of you. So what is the association doing to make the public know that they are there, and to make the public know that these are the things that you can do to help people?
I must admit that we haven't made the effort to, how do you call it, showcase what the possibility that association can direct people as to what to do when it comes to traditional healing. Now you talk about herbal hospitals. Mm-hmm. You know, those are private establishments. And it is not, how do you call it, ethical to say this man don't go there, that man don't go there. So our biggest problem as far as our culture and our traditional healing is the indoctrination through schooling and foreign religion that all our traditions and what we do is demonic. So people are even afraid to approach traditional healers, even if they want to. Some, because of that, they go, and I know about that, they go at night so that nobody sees them, that they are going there. So they have educated or miseducated the general public through foreign religions to avoid our traditional medical practices, which is to the detriment of us. And our association through media like yours is to tell the public that there is nothing wrong with traditional healing. Nobody is saying that go and do anything terrible over there. You are only presenting yourself that you're not well and you want help. And they can give you help as well as they can. But we also got to know, have in mind that there are some healers who will not tell you exactly anything. because they want money. They say, "Oh, we can help you," when they cannot help. That's the biggest problem. But if through your media, through any, how to call it, contact, if they can contact you, then we, through our association, can direct them to specific healers whom you know and trust can help.
Viewers, today we have come to learn so much about traditional healing. Like doctor said, some of us are afraid to even approach the traditional healers because of some things that we believe. But today doctor has made us to understand that you can come for healing from the traditional healers and you are okay, you don't have a problem. This is Mystery Professionals TV. We like to bring you the best. That is why today we are here to introduce this association to you. To contact them, even to, if you need a traditionalist who can really help you with your ailment, you can contact them, and then they will refer you to a good traditionalist or a good herbalist who can help you with your ailment. Okay, so you can contact Mystery Professionals TV. Thank you so much for being with us. Please subscribe and share so that we can grow together. The more you subscribe, the more we'll grow bigger, and then we'll bring you more interesting topics. Thank you very much for joining us today. And we also thank our able camera lady, Miss Rejoice Fiado. Thank you all for being with us.